All right, if you are gearing up for the NCLEX, you know electrolytes can be an absolute beast. But what if you had the ultimate cheat sheet to finally lock them into your brain for good? Well, that is exactly what we are going to break down right now. Look, the NCLEX isn't trying to trick you, it's designed to make sure you're a safe nurse. And as this points out, that means the most deadly conditions are almost always the most tested conditions. And let me tell you, electrolyte imbalances, they are right at the tippy top of that list. And that pressure during the exam? Oh, it's real. You've got all these values, all these symptoms just swimming around in your head. So, what's the secret? How do you remember it all when it really, really counts? Well, that's what this is all about. We're going to give you the cheat codes. First up, let's tackle the big one, potassium. The absolute best way to think about this one is to remember it's the king of the heart. Pretty much everything it does comes right back to cardiac function. Okay, first things first, before we do anything else, you have got to know your numbers. For potassium, that magic range is 3.5 to 5.0. Seriously, write it down, burn it into your brain. One more time, 3.5 to 5.0. And now for the fun part, the memory trick. This is your very first cheat code. Just think of potassium's priority. The P stands for pumps the heart. It's that simple. P for potassium, P for priority, P for pumps. And here's exactly how that rule plays out. If your potassium is high, the heart's pump goes into total overdrive. On an EKG, you'll see signs of this overstimulation, like those classic peaked T waves. But on the flip side, when potassium is low, the pump gets super weak and slow. This is just as dangerous, causing things like flat T waves and even shallow respirations. Because remember, your respiratory muscles are pumps too, and they get too weak to work right. All right, you got potassium down? Good. Let's move on and see how this all connects with our next big player, sodium. If potassium is all about the pump, sodium is all about the fluid. It is the body sweller. And here is your next cheat code. First, the number you have to remember is 135 to 145. Now, for the function, the S in sodium stands for swells the body with fluid. Sodium is like a magnet for water, so wherever sodium goes, you better believe water is right behind it. So let's see how this works, because it's a little different than you might think. With high sodium, what we call hypernatremia, water gets pulled into the bloodstream and the whole body gets big and bloated. Think edema, puffy skin. But with low sodium or hyponatremia, something else happens. Water leaves the blood and rushes into the cells, causing them to swell up. Now, this is especially dangerous in the brain. That swelling, cerebral edema, can lead to seizures and even respiratory arrest. So, to keep it simple, high sodium swells the body, low sodium swells the brain. Okay, next up, we've got our real power couple, magnesium and calcium. And trust me, the absolute best way to remember these two is to think of them as total opposites, always doing a delicate dance with each other. So here is the main idea you have got to lock in. Magnesium, starts with an M, is here to mellow the muscles. It's the chill-out electrolyte. Then you've got calcium, starts with a C, which does the exact opposite. It contracts the muscles. Seriously, if you just remember those two words, mellow versus contract, you are halfway there. So let's break that down for magnesium. If you have too much of it, everything gets, you guessed it, too mellow. Your reflexes go down, the heart rate drops, breathing slows way down. But what happens if you don't have enough magnesium? Well, the body has no mellow left, and it gets way too excited. You'll see overactive reflexes, and in the heart, this can cause a really deadly twisting rhythm called torsades de pointes. Now let's flip it for calcium. Remember, it contracts muscles. So with too much calcium, muscles are overcontracted to the point of exhaustion. This actually leads to severe muscle weakness and constipation. But with too little calcium, the muscles just can't calm down. They get too excited. And this is where you see those two super classic, you will definitely see this on the NCLEX signs. Trousseau's sign, where you pump up a blood pressure cuff and the patient's arm spasms, and Chevau's-Steck's sign, where you tap the cheek and their facial muscles twitch. Okay, but wait. You can't really talk about calcium without bringing up its partner in crime, phosphate. And these two have a very specific, and I mean very testable, inverse relationship. And this slide just lays it out perfectly. They're basically on a seesaw. When calcium is high, phosphate is low. And when calcium is low, you better believe phosphate is high. So what does that mean for you? Well, if you see the classic signs of low calcium, like that Trousseau's arm spasm, your brain should immediately think, I bet their phosphate is high. They're two sides of the same coin. Okay, you ready? Let's do a super quick rapid-fire recap of our main cheat codes. Potassium pumps the heart. Sodium swells the body. Magnesium mellows the muscles. And calcium contracts the muscles. Boom! That's it. Those 4 simple phrases are your golden ticket for these questions on the exam. So now that you've got the cheat codes, let's put them to the test. I'm going to leave you with this little clinical scenario. A patient shows up with sudden, dangerous changes on their cardiac monitor. Based on what we just went over, which electrolyte imbalance are you going to look for first? The answer to that question? That's you starting to think like a safe,